Well, burn injuries are very traumatic to the human body, and often care for those are months, even years to heal fully. A lot of them require several extensive surgeries depending on the type and severity of the burn injury. That's why we want to get the information out to try to prevent these type injuries and keep people from having to go through this, the pain and the effects of burn injuries.
So the first thing you want to do is stop the burning process, whether that is scalding, whether it is fire from something catching fire in the microwave, whether it's a chemical burn. You want to get that away from the skin. And then you want to make sure to take off any restrictive materials, so a belt, if you have rings on your hands, watches, that type of thing. And then immediately cool the area. You want to use cool water, not something that's really ice cold. You want just cool, clear water to rinse the area. And then you're going to pat it dry and keep it covered. Depending on the severity of the burn, that is when you determine whether you seek medical attention or not. A first-degree burn, which is very similar to a sunburn, you can treat at home easily. When you get into second degree and then, of course, third-degree burns, that's when you would seek medical attention. But really and truly, just clearing off the area, patting it dry, and only using something that is like a lotion-based or even an aloe-based item. You don't want to use something like butter or Crisco. Those are all wives' tales. And initially, at least, you want to avoid using Neosporin or some type of ointment because those just insulate the burn and they will actually cause the burn to get worse. So by just using those water-based items, you're much safer. So one of the things that people do is they talk about popping the burn, and we don't want that to occur. You want to keep those blisters intact because they are sterile underneath. You want them to naturally absorb. So the only time you would pop a burn would be if you have a medical professional do it under a sterile type environment.
Unfortunately, in our business, we do see a lot of burn injuries, and the key here is really prevention. Most of those accidental burn injuries can be prevented. So we see lots of different burn injuries in different ways, and we know that we can prevent those. And just by simple education of our public, we can educate those and reduce the amount that those happen. I know with these kind of injuries, these are lifelong injuries. A burn injury is probably one of the most painful injuries you can receive. We highly recommend that you go seek professional help, even with minor burn injuries, to avoid any kind of infection or any kind of adverse effects from trying to do self-treatment. Most of our public think, well, it probably won't happen to me, and that's what sets us up. That complacency gets us every time. So we just want our public to be safe. I would like for our folks to not ever have to see another burn injury. And unfortunately in our business, that's something that's inevitable, but I do think we can do a lot through prevention.